Welcome and good afternoon. I'm Brian Laux, Program Coordinator for Cardiac and Pulmonary Rehab at the University of Maryland, Charles Regional Medical Center. Whether you've just been diagnosed with diabetes, have had it for years, or are looking to support a loved one who may be at risk for diabetes, one thing is certain: lifestyle changes can make a big impact on your overall wellness. Today, we have some great providers who will be discussing what diabetes is, the different types of diabetes, and how to manage diabetes and prediabetes. They will also answer any remaining questions that you may have at the end. Before we get started, we have a few housekeeping items to address. For the best view of this webinar, choose the side-by-side view in the top right hand of your screen. If you experience technical difficulties, post your issue in the Q&A panel found in the bottom right of your screen. This event is being recorded, so you can view it at a later time as well. This is an interactive webinar, and we want your participation. We encourage you to submit written questions at any time during the presentation using the Q&A panel in the lower right of your screen. We will address questions during the Q&A session at the end. Please don't hesitate to ask a question. Questions will be shared anonymously, and we are all here to learn right alongside you. To begin, we're going to ask a few anonymous poll questions to help guide our discussion today. For those of you in the audience, please take a moment to answer these questions. Poll question number 1. Have you been diagnosed with diabetes? Yes or no? Poll question number 2. Have you been diagnosed with prediabetes? Yes or no? And question number 3. If you are diagnosed with diabetes, which of the following best describes you? A, my diabetes is well controlled. B, I am looking for ways to improve my diabetes management. Or C, I just want more information. Please take a minute to answer the poll. According to our poll results, 14% of today's attendees have diabetes and 14% have prediabetes. Today, our providers will help offer tips to lower your risk of diabetes and help you manage diabetes and prediabetes if diagnosed. Let's go ahead and start our discussion today. Joining us is Teresa English, Certified Diabetes Educator at the University of Maryland, Capital Region. She is a longtime nurse who decided to become a diabetes educator and counselor after working as a wound care nurse in the hospital. Thank you for joining us today, Teresa. Could you please share with us a little bit more about yourself?
Yes, thank you, Brian. Welcome, everyone. My name is Teresa English, and I've been a nurse for almost 30 years. Many of the patients I was treating in the hospital suffered extremity wounds and nerve damage as a complication of diabetes. And as I was working with them, I realized that managing diabetes would greatly help in preventing and in the healing of these wounds. I currently work at the Diabetes Center here at the University of Maryland, Capital Region Health, and I help people with diabetes meet their blood glucose targets, and so help prevent those long-term complications of uncontrolled diabetes. And for those with prediabetes, I pass on to them the good news that I'm going to share with you all today as well, that there is so much that can be done to prevent the progression to type 2 diabetes. I want to use a loudspeaker to pass on this good news that type 2 diabetes can be prevented. Your family history does not determine your destiny. If each person leaves today with the knowledge and confidence that the risk for type 2 diabetes can be greatly reduced, my job has been accomplished.
Great, thank you, Teresa. Also joining us today is Stephanie Stowers. Stephanie is a population health coordinator and diabetes educator at the University of Maryland Charles Regional Center for Diabetes Education. Thank you for joining us today, Stephanie. Could you also share a little bit about yourself as well?
Thank you, Brian. I'm Stephanie Stowers. I work here at Charles Regional Medical Center and the Center for Diabetes. During my nursing career here at University of Maryland Charles Regional, I've had a particular focus on population health, chronic disease education. I was previously a nurse navigator for Charles Regional with a background in emergency department, ICU, dialysis, and orthopedics. While educating the patients about their chronic disease while they were inpatient, we found that there were many patients that had additional medical problems because their diabetes was so uncontrolled. And many of these additional problems could be controlled if their blood sugars had not been so high and caused these complications. So now I work for the Center for Diabetes Education. I provide diabetes self-management training to participants with prediabetes, diabetes, gestational diabetes here at Charles Regional. And I've spent most of my nursing career serving the community here in Charles County. I have a particular interest in the participants learning to manage their health on their own with our help for them to reach their most optimum wellness. Health promotion is key to helping our community members to manage their health and achieve their wellness.
Awesome, thank you for joining. Now let's go ahead and we'll start the conversation. So we have a few questions for both of our speakers today. Our first question is, could you give our audience an overview of what diabetes is and why we should care about it? Stephanie, if you want to go first.
Sure, thank you, Brian. When a person's diagnosed with diabetes, the food they eat cannot be used for energy. Diabetes causes the blood glucose or blood sugar levels to rise higher than normal. The body does not make enough or use the insulin that it naturally produces in the pancreas, an organ located in our abdomen, and that feeds the cells and provides the energy. Insulin is a hormone that's made by the body, and it helps move sugar from the blood to the cell to be used for energy. Think of the cell as a house with many locked doors. Insulin is the key that unlocks those doors and lets the sugar enter the cell. Once the sugars entered the cell, we can use that for energy. According to the American Diabetes Association, in 2018, 34.2 million Americans, or 10.5% of the population, had diabetes. Of the 34.2 million adults with diabetes, 26.8 million were diagnosed and 7.3 million were undiagnosed. 1.5 million Americans are diagnosed with diabetes every year, and the total cost of diagnosed diabetes in the United States in the year 2017 was $327 billion. What you do today helps determine how diabetes impacts you tomorrow.
Okay. And Teresa, did you want to follow up on that? I think you might be on mute right now.
There we go. Thanks, Brian.
Go.
Thank you, Stephanie.
No problem.
Yes, I wanted to follow up and talk about how type 1 and type 2 diabetes differ, because many people don't realize that those are actually different diseases. Type 1 diabetes, the body completely stops making insulin. Type 2 diabetes means your body doesn't use insulin properly. Your body either doesn't make enough insulin, or the body makes insulin, but your cells are resistant to it. And about 90 to 95% of people with diabetes have type 2 diabetes. About 5% have type 1. Type 1 diabetes often starts quickly and has severe symptoms, whereas type 2 is much more gradual. It develops over many years, and often people will be told by their doctors, you know, your blood sugar is beginning to climb. Those kinds of statements are heard as it slowly develops. The prediabetes can develop into type 2 diabetes, but not into type 1. And chronically elevated blood sugar levels damage blood vessels. And because blood vessels are present throughout the body, uncontrolled diabetes can affect every major organ in the body. People with uncontrolled diabetes can develop kidney failure, blindness, and nerve damage. And that's why it's so important to keep those blood sugar levels within target range.
Great. So why don't we go ahead? You mentioned prediabetes earlier, so why don't we go ahead and start with that first? Can you tell us a little bit more, Teresa, about what prediabetes is?
Yes, what prediabetes is when your blood sugar levels are beginning to climb, but they haven't yet reached that level where you would be diagnosed with diabetes. And what we have up on the screen now is the prediabetes risk test. And I would actually encourage all the participants to take this test. It just takes a few minutes and it'll tell you your risk for developing prediabetes. So there's many risk factors. One is your age. So the older you are, the greater your risk. Are you a man or a woman? Gender does play a role in your risk for diabetes. If you're a woman, have you ever been diagnosed with gestational diabetes, which Stephanie talked a little bit about earlier? If you have had gestational diabetes, you are at greater risk for developing diabetes. So you need to talk to your doctor about possibly getting tested for it more frequently. Do you have a mother, a father, a sister, or a brother with diabetes? There is a genetic component, and if you have that genetic component, you're at greater risk. Have you ever been diagnosed with high blood pressure? Are you physically active? Inactivity does lead to a greater risk for diabetes. And then what is your weight category? The heavier you are, the greater your risk for developing diabetes.
Great. So how does someone know if they are at risk for prediabetes? And is this something that they should get tested for?
Yes, so get a baseline A1C test if you're an adult over the age of 45. And I'll go over a little bit what that test is. It's a blood test ordered by a primary care doctor. It can be done as part of an annual physical. And what the A1C test looks at is how much sugar is coating your red blood cells. Oh, thank you. So it gives the doctor an idea of, over the past 3 months, what is your average blood sugar level? So thank you. If you look at the screen, you can see an A1C test of less than 5.7 is a person without diabetes. If the test comes back at 5.7 up to 6.4, that average daily blood sugar is climbing. It's between about 117 to 137. You would be in the prediabetes range. If your A1C is 6.5% or greater, your average daily blood sugar is running over 140, and this would be diagnostic for diabetes. So this test would be done baseline at 45. If you're under 45, but you have some of those other risk factors like being overweight, having prediabetes, then they would want to test more frequently. So you would repeat the test every 3 years after the age of 45. If it does show prediabetes, you want to be checking at least every year to make sure you have not gone into diabetes. If you have no symptoms, but your test result shows you have prediabetes or diabetes, get a second test on a different day to confirm the result. And if your test shows that you have diabetes, sign up for education so you can have the best start in managing your diabetes. Does Does anyone have any questions? I know that's a lot of numbers.
Yeah, I think we'll probably, if you have a question, just put that in the Q&A panel on the right, and we'll get to some of those at the end. So with diabetes, we hear a lot about blood sugar and blood sugar numbers. So could you maybe just follow up on that and kind of go into what blood sugar is and the difference maybe between the pre-diabetes and the diabetes blood sugar numbers?
Yes. So somebody without diabetes, if you prick their finger before meals when their stomach is empty, their blood sugar level will be between about 70 to 99. Sugar in the bloodstream is necessary for life. So it's present. And if it's less than 100 fasting, you're considered to not have diabetes. If you prick the finger before they eat and that blood sugar is between 100 and 125, the sugar level in the blood is mildly elevated, and this would put you in the pre-diabetes range. And if you prick someone's finger before they eat and their blood sugar is 126 or higher, this would be a sign that they have diabetes, that their body's not able to metabolize that sugar. As Stephanie said, move it into the cells. So it's backing up in the bloodstream, and you're seeing that when you do the blood sugar test.
Okay. So if someone has pre-diabetes, should tracking their blood sugars be something that they're doing?
That's a great question, and they can talk to their individual provider about that. I know for myself, I was diagnosed with pre-diabetes, and it was very helpful to learn how to check my sugar so that I could learn how my body responds to food. So there's no rule that says someone with pre-diabetes needs to be pricking their finger and checking their blood sugar, but I would recommend it from personal experience so you can learn about your own body.
Okay, so it sounds like maybe it's more of a physician preference in the pre-diabetes category. But is this something that they can do themselves, or is this something that the doctor needs to do for them?
No, they can learn how to do it, and you can purchase a meter at the drugstore, at Walmart. The physician can teach them, the pharmacist can teach them.
Okay, very good. So getting kind of segueing a little bit from pre-diabetes into diabetes, what are some of the common myths that you typically see surrounding diabetes?
Okay.
Did you get that?
Yes, you were saying the common myths surrounding diabetes?
Yeah, so what are some of the common myths that you see surrounding diabetes?
For example, like if I eat a lot of sugar, will I get diabetes?
Yes.
Yes. Okay. So the answer would be no. There are many risk factors for developing diabetes, as we had reviewed a little bit earlier, and those include increasing age, being overweight, a family history. Eating a lot of sugar may indirectly contribute if it leads to weight gain, because increasing weight puts you at risk. And if you have diabetes, eating a lot of sugar will lead to an elevated blood sugar level, because once again, your body's not able to metabolize that sugar efficiently.
Right. So with diabetes then, are there some ways that diabetes can be prevented?
Yes, yes, there is. Uh, Prediabetes is a condition in which these blood sugar levels are higher than normal, but like you can see on the screen, it's not yet at that level of diabetes. However, even in the prediabetes stage, you are at increased risk for heart disease and stroke. So it's very important to start paying attention to this once you get to the prediabetes stage. And about 20 years ago at NIH, they did a very large clinical trial. They looked at about 3,000 people who had been diagnosed with prediabetes to see if there was anything that could be done to prevent that progression into diabetes. So about a third of the people, They did what we've been doing for years. The doctor just tells them lose weight and exercise. Another third, they started them on a medication called metformin. And the last group, they put them in a structured program to help them with modest weight loss, maybe 7 to 10%, and increasing their physical activity to about 150 minutes a week. The results were so significant that they actually stopped the clinical trial early so that they could get this information out to the American people. And that structured program is what is now known as the Diabetes Prevention Program. That program showed you could reduce your risk of developing diabetes by about 58%. And for those over the age of 60, the results were even more significant. They reduced their risk by a little over 70%. And those results have been sustained. So they stopped that trial early. They started offering grants to hospitals throughout the country. And hospitals now provide these diabetes prevention programs. The YMCA also stepped in and said, we can get the word out even more. So they were approved, and you can take the program through the YMCA. And Weight Watchers actually has also been approved by the CDC for diabetes prevention. So there's many different options for people in the community, but the important thing is to sign up for that program because the structure and that accountability seems to be what makes the big difference. So with a diabetes prevention program, you will work with a trained coach to make lasting lifestyle changes. You'll discover how to eat healthy and add more physical activity to your day. You'll find out how to manage stress, stay motivated, and solve problems that can slow progress. So if you're told you have prediabetes, ask if there's a diabetes prevention program offered in your community. And please feel free to call Stephanie or myself as well. And at the end of this presentation, there will be a list of community resources.
Okay, so just to recap that, it sounds like to prevent diabetes, mostly lifestyle changes really would do the trick, as far as moving more and watching your diet, maybe losing some weight, getting into a pre-diabetes program. Sounds like it would also help us from a support perspective.
Yes.
Okay.
Yes, I think that support is what made all the difference.
Yeah. Okay, great. Well, thank you, Teresa.
Thanks, Ray.
Now we're going to shift our discussion a little bit towards those that have been diagnosed with diabetes. So we're going to bring Stephanie back into the fold here. So Stephanie, Teresa mentioned this earlier, but could you maybe just recap again what the A1C is and why it's important?
Sure, thanks, Brian. The A1C is a test that your healthcare provider orders to see how well your blood sugar has been controlled over the past 3 months. So it's a blood test that your doctor can order, and the test reveals how much sugar is attached to your red blood cells. Higher A1Cs and higher glucose levels or blood sugar levels are related to an increased risk of diabetes complication. That's why your doctor may stress to lower your A1C level. Reducing your A1C 1% may greatly reduce your risk of complications, for example, an A1C of 8%. Reduced to 7% may reduce the risk of eye, kidney, and nerve damage, 37%. The American Diabetes Association recommends an A1C goal of less than 7. I have here an example of our A1C. Here we have a healthy A1C level where you see the little sugar crystals are attached to your little red blood cell, and there's not too many. On the other side, there's a lot of sugar crystals that are attached to the red blood cell. As your A1C gets higher, your blood moves slower in your blood vessels, as you'll see with the high A1C level. This puts you at risk for heart disease, stroke, blood clot, and other complications. So that's part of the reason for the big push to get your A1C into a healthy range.
Okay, so the A1C, that's a great visual, by the way. But the A1C, it sounds like it's just the glucose or the sugar that's attaching to that red blood cell then. And it's a
That's
number of how much is attached, basically.
That's right, Brian.
Okay. So talk to us a little bit about high blood sugars and low blood sugars. What might be considered a high blood sugar and what might be considered a low blood sugar?
Sure. So a high blood sugar, also known as hyperglycemia, is a blood sugar reading that's over 180. So say you test your sugar, you prick your finger, you use your machine, your glucometer, and your reading is over 180. High blood sugar is considered over 180. That's when there's too much sugar in your bloodstream. High blood sugar can occur if you skip a dose of medication for your diabetes, if you eat more than usual, if you're less active than usual, if you're under stress or sick. Signs of high blood sugar are increased thirst, needing to go to the bathroom to pass urine more often, increased hunger, you may become sleepy, have blurred vision, or infections or injuries may be slower to heal. Drinking water will help to flush some of that extra sugar out through your kidneys and through your urine. Taking a walk will help burn the extra sugar as energy. But we do not want you to try to exercise if your blood sugar is higher than 250. That can cause extra stress to your body and have the opposite effect of bringing your sugar down. If your glucose levels are listed as high, HI on your meter, or higher than 400, we consider that an emergency situation that you would need to seek help for. On the other side, the low blood sugar, or hypoglycemia, is a blood sugar reading that's less than 70. Low blood sugar is when there's not enough sugar in your blood. And like Teresa mentioned, we need blood sugar. We need some sugar in our blood to maintain life. That's essential. Low blood sugar can occur if you take certain medications, if you eat too few carbs, if you took too much of your medication, or if you skip or delay a meal, if you're more active than usual. And we see that quite often in the spring when people go out and start doing their yard work. They may eat a light breakfast, they work through lunch, but they took their morning medication, and maybe about 2 o'clock, they're really feeling the effects of that low blood sugar. That's quite common. So if you do experience a blood sugar of less than 70, we want you to treat that with the rule of 15 is what we call this. So it's 15 grams of fast-acting carbs, 4 ounces of regular soda, 4 ounces of juice, 4 glucose tablets. You could even use 15 jelly beans if that's what you have, 4 or 5 hard candies, just not sugar-free. Wait 15 minutes, check your blood sugar level again. If it's over 70, have a snack, something with carbohydrates and protein, maybe some peanut butter crackers to keep your blood sugar up. If it's still below 70, treat for another cycle. Just like we said with the 15 grams of carbohydrates, fast acting, wait 15 minutes, check again. If your blood sugar is still less than 70 after 3 cycles, we want you to seek help and continue to treat until help arrives.
Okay, so you mentioned some of the food options and carbs specifically. When it seems like sometimes when people get diagnosed with diabetes, they're like, oh, I got to change my diet. I got to make all these changes. So what should somebody be eating or drinking if they have diabetes? And what are carbs specifically?
That's a great question. A lot of times when we see people that come in for education, they may have heard that they should cut out all carbohydrates. They may say, I'm not eating any bread. Don't worry, I stopped eating all the bread, all the pasta. But we want you to have the right amount of carbohydrates. Monitor your portions and your carbohydrates. So carbohydrates come from our food groups, including starches, like our bread, our noodles, pasta, rice, potatoes, things like that. It also comes from fruit, like our apples and our bananas. and our milk products. Our bodies break down those carbohydrates and turn it to sugar, which then we use for energy. What you eat is important. Eating 3 meals a day and adding snacks as needed will help you to regulate your blood sugar. We would like for you not to go longer than 4 hours or so without a meal or snack with carbs. For example, if you woke up at 5 o'clock in the morning and you eat breakfast by 6, but you get delayed with your lunch and you don't get to eat until 2, a mid-morning snack would have served you well. A snack of 15 to 30 carbohydrates or 1 to 2 servings will help you to keep your blood sugar on an even, not quite a roller coaster, but we want you to have kind of an even keel of your blood sugars. Eating every 4 hours or so, 4 to 6 hours while you're awake, will help you to keep your blood sugars regulated. Also, a bedtime snack of protein and carbohydrates can be very helpful to start your morning off right. It sounds funny to say that a bedtime snack will help you to lower your morning blood sugar, but it actually does work. So men should have 45 to 60 grams of carbohydrates with each meal, while as ladies should have 30 to 45 each meal. Snacks again should be 15 to 30 grams of carbohydrates. And we'd like to suggest eating a balanced meal, and we refer to my plate, where we divide our plate half into vegetables, non-starchy vegetables. You add a fruit, a milk product, which you get your carbohydrates from your milk products, from your fruit, and then to add your vegetables are free if they're non-starchy, and then your protein. So that you can add a balanced meal if you use all of your food groups. You can refer to My Plate or myplate.gov for additional information on the My Plate and how to eat a balanced meal. Just eating the lower end of the carb recommendations for a meal, say 45 for men or 30 for women, can help you to reduce your weight as well. But we don't want you to eliminate carbs or to try to reduce your carbs completely out of your diet. You need the right amount of carbs with monitoring your portion size.
Okay. So I think I heard you mention a little bit earlier that the food that we eat becomes energy for our bodies. So in some of this energy balance, can you kind of talk a little bit about how exercise is important if you have diabetes?
Absolutely. Just along with our medications that we take for diabetes and what we eat, we also need the other part of the puzzle, which is exercise. Of course, discuss any new exercise routine with your doctor before starting, but exercise can lower your blood sugar for 24 hours. So aiming for 30 minutes of exercise a day for a total of 150 minutes per week. Walking, chair exercises, those are great ways to start with exercising if you haven't been used to. Adding some exercise to your day. Just adding any sort of movement, water aerobics, swimming are options if you have arthritis. Exercise can help you to maintain weight. For some people, losing 10 or 15 pounds can really improve the body's use of insulin in the blood. And return that normal blood sugar for most levels. Just that exercise can really bring your blood sugar levels down. The combination of weight loss and exercise will really help improve those blood sugars. We also want you to monitor your blood sugar while you're exercising. It may lower your blood sugar really well. So we want you to carry a carb snack with you in case you experience a low blood sugar.
Okay. Great. Last question for you. If someone has diabetes, should they see a specialist for this diabetes?
So that's a great question, Brian. While many people manage their diabetes with their primary care providers, there are partners that can be added to help manage blood sugars and complications as needed. An endocrinologist is a doctor that focuses on managing diabetes and complications if needed. Your primary doctor may ask you to see an endocrinologist if you need additional help managing your blood sugars. A neurologist is a doctor that focuses on the brain and nerve endings. That doctor may be consulted if you develop what's called neuropathy. Neuropathy is described as burning or tingling in your fingers or your toes, and that doctor can help you along with those symptoms if need be. A nephrologist is a doctor that focuses on the kidneys, and that doctor may be consulted if you need help managing complications with kidney problems related to diabetes. A podiatrist or a foot doctor may help you with your feet. Sometimes they're helpful for checking your feet for wounds that you may not have found on your own, or cutting your toenails in a safe way, especially if they're thickened. That doctor can really be a great asset for checking and taking care of your toenails. And an eye doctor can help you to manage complications with your eyes. A dentist, and this is usually missed, but a dentist can help maintain healthy teeth and gums. Some people don't realize that diabetes can affect your gums and your teeth. These healthcare team members can help provide insight and treatment when needed to help you better manage diabetes, treat complications, and minimize the risk of complications.
Okay, so it sounds like some of these specialists are good just for treating the diabetes, but then maybe some of the other specialists are good if you start having complications from the diabetes, correct?
Yes, Brian. So your primary doctor may call in more team members to help you with a specific body system, say a nephrologist for your kidneys, if you start to develop kidney problems related to diabetes.
Okay, well, great. So that was some great information. Thank you. We're gonna segue now a little bit towards our Q&A with the audience. So let's continue the conversation by taking some questions from members in the audience that they're submitting. Please remember that your questions will be shared anonymously. No question is too much, and chances are, if you have a question, someone else has that same question. So our first question here from the audience, it looks like we have one. If you have prediabetes, are you doomed to have diabetes, and can you stop diabetes? If so, how? And do you have to take medications? Maybe Teresa, if you want to start with that one, we'll rope you back in here.
Unmute. Hi, Brian. The answer to that question is no doom. No doom. I would recommend that this person sign up for a structured diabetes prevention program, and it has shown that it will greatly reduce their risk. Not all of the risk factors are within a person's control, such as age and ethnicity and family history. So there's no guarantee that the person won't move into diabetes, but a structured diabetes prevention program is their best bet, and it's been shown to be wildly successful. So I would recommend this person contact the diabetes center at their local hospital to find out about a program that they could sign up for.
Okay, and Stephanie, did you have anything to add to that?
I think there's a lot that we can do. While, like Teresa said, we can always take care of the factors that our genetics present, we can make lifestyle changes that can have a big impact on our health overall.
Okay. So next question. Can diabetes be cured or reversed? And maybe Stephanie, will start with you on that one, and then if Teresa has anything to add.
Sure. While there's no cure or reversal for diabetes, there are steps that you can take to control your blood sugar and minimize the risk of complication. Diet, exercise, blood sugar monitoring, and taking your medications as prescribed can all help you to take control or manage your diabetes.
Okay. And Teresa, anything to add to that?
Yes, I'll add a picture that my mentor always emphasizes, and that is the three-legged stool. That if you want to have a nice steady blood sugar, you got to pay attention to each of those legs, because if you neglect one, you topple over. So one leg would be medication, and not everybody needs it to manage their blood sugar. But if you need it to take your medication, and then, as Stephanie was saying, lifestyle changes, focusing on diet as the second leg of the stool and physical activity as the third leg, you can bring that blood sugar level into target. That doesn't mean it's cured. It means it's managed with those treatments. And I have known of people that say, oh, I'm cured, and have actually stopped taking their medicine. So that's why I want to emphasize the importance of continuing to monitor and to follow your doctor's orders.
Okay. Yeah, I like that analogy of the stool. That's really good. Next question is, what can I do to support a person or a loved one to control their diabetes? And maybe Teresa, we'll start with you on this one.
Uh, Take a walk with them after meals. Help with cooking healthy rather than, maybe being a saboteur and bringing cake and everything into the home, to try to bring things into the home that support good health. A dietitian once said, when they walk into your home, do you feel like you're walking into a health spa or a movie theater? So if you're living in the same house with someone, what can you do to make it more of an environment that supports their good health rather than an environment that encourages them to adopt unhealthy habits?
And Stephanie, anything to add to that?
I would say to be encouraging and positive and supportive to your loved one. Healthy eating and exercise can be appreciated across the lifespan, and whether you have health problems or not, if you have high blood pressure, it can benefit, whether you have diabetes, but across the lifespan, our eating healthy, monitoring portion size, and getting our regulated exercise can benefit everyone. So that's another way that we can support. Like Teresa said, just taking a walk with your loved one can be a support enough.
Okay. So Stephanie, another question. We'll start with you on this one. Do the stickless meters work?
So I think they may be asking about our continuous glucose monitors. And that's what I'm thinking that could be. And we have seen success with patients that have the continuous glucose monitors, that if they were resistant to checking their blood sugars because maybe it was inconvenient or painful, or they just were not comfortable bringing their meter out in front of others, but maybe they have a new continuous glucose monitor that they may scan instead of pricking their finger. They're more compliant, we are finding, with managing blood sugars and recording and things like that. So I do think that those can be helpful, especially if there were barriers to checking your sugar overall.
Okay. And Teresa, anything to add on that?
No, nothing to add. I especially like that she said, because there are many people that are resistant to checking their blood sugar. So using these continuous glucose monitors helps them to see better what's happening inside and will motivate them to make those healthier changes.
Okay. So next question, we'll stick with Teresa on this one. Going back to one of the legs on her stool. This question says, I have trouble fitting exercise into my day. Do I have to exercise for 30 minutes each time?
That's a great question. And I have so much trouble fitting exercise into my day. It is really hard to set aside that half hour on a consistent basis, depending on what's happening in your life. Some things that have worked well with me that I'll share is walking after meals that I think Stephanie may have touched on a little bit. Even without diabetes, when you eat, your blood sugar naturally rises after you eat. So it's a very good idea if you're thinking about the timing of exercise, if you could time it after your meals. So instead of 30 minutes, maybe after each meal, walk 10 minutes. That would give you your 30 minutes throughout the day, and you're getting the biggest bang for your buck because you're going to help to stabilize that blood sugar after you eat. And I actually have a little pedometer. So if I'm waiting at the elevator or at the copy machine, I get in a few extra steps. And then throughout the day, I see it build up so that at the end of the day, when I'm tired, I can see that I've really put in a lot of activity.
That's a great point with the pedometer and just kind of tracking your steps throughout the day. Stephanie, anything you would like to add to that?
Thanks, Brian. I'd like to say that if you are discouraged by the thought of 30 minutes of exercise a day, any movement will help as you build towards that 30 minutes. So maybe you can do 10 minutes this week, but next week you add 5 more minutes. And then you work towards the 30 minutes a day overall. That can be a goal that you can reach. It is attainable.
So that's a great point as well. We'll stick with you on this one, Stephanie. We're going back to some of the food aspects of diabetes. So this question says, I'm not a breakfast eater and I usually skip it. What can I do instead of breakfast?
Sure, that's very common. We see that a lot of people with busy lifestyles, they're trying to get their commute to work, and a lot of times breakfast is the last thing on their mind. Breakfast is really an important part of your day because it can close that gap from your last snack at bedtime to your first meal in the morning. And if you're not necessarily a breakfast person, you can pack easy things to go, things that you could eat in the car, like a granola bar, overnight oats, maybe a banana, or a single serve applesauce container. If you are unable to fit a full breakfast meal, still break that fast with a snack, maybe even some peanut butter crackers, a yogurt and graham crackers, or just a few ideas there. Most important is that you have a snack, if not a meal, within an hour of waking to start your day.
Okay, and Teresa, anything you would like to add to that?
No, nothing to add. Thank you, Stephanie.
Okay. So our next question, I think, touches a little bit on what Teresa mentioned earlier about joining one of the pre-diabetes groups. So I think this is what this question is intending. But it says step one would be to join a group. What would step 2 be to start?
Well, step 1, join a group, and then step 2, go. Because so often we all start so highly motivated, and then this program is actually a year long, and it's intentionally that long because making changes is not a quick process. So often people start highly motivated, and then other things creep in. So I would say step 2 is when you feel like going, you go. And when you don't feel like going, you go. And when you're motivated, you go. And when you're discouraged, go. And just trust the process. The science is really there. This is a process of getting well. So trust it and stick with it. And with these programs, they draw a baseline A1C, and they'll draw another one when the program is over. So you will see the results.
Okay. Stephanie, anything you'd like to add?
I would say that you should find the reason why you want to make the change. If you look at your why that you want to make the change, whether it be that you want to avoid complications, if you want to feel better, if you want to be around for a long time with your loved ones, whatever your reason behind your change, focus on that when it's hard to go to these, make these changes. That can really be a driving force.
Okay. So we're starting to run out of time, but I have 2 more questions. So hopefully we can get both of them in. So maybe quick rapid fire, one for each of you. We'll go back to Teresa on this one. So with exercise, Teresa, what if you're in a wheelchair?
There's always movement that you can do. And just as you said, wheelchair, I was thinking of some of those videos, even like sitting exercises that can be done, that you can get for free on YouTube. Another suggestion, if I was in a wheelchair, I would actually ask to maybe see a physical therapist and let them, because they know all the different muscles, and they could maybe set up a program where even with limited mobility, I could work all the muscles. So that's what I would recommend.
Okay. That's a great point there. And then last question here for Stephanie. Should you eat 5 to 6 times a day?
We encourage our participants to eat 3 balanced meals a day and then work your snacks in as needed. If you are going to go longer than 4 hours or so in between meals, then we want you to add snacks. So depending on how your day goes, you could have 3 meals and 3 snacks. If you have a mid-morning, mid-afternoon, and bedtime snack in between your 3 balanced meals, you could end with 3, as you may think of as meals. But your snacks don't have to be Thanksgiving dinners. They don't have to be large. It can be a granola bar, a piece of fruit, maybe a few crackers and peanut butter, a cheese stick, and a few crackers or something like that. It doesn't have to be a large meal to have your snack, just to keep your blood sugar on an even.
Okay. So that's a great point as well. So thank you both for answering the audience questions and for being here today. And thank you to everyone in the audience who submitted questions as well. We're going to close with one final question for both of our speakers today. Teresa, what are your top 3 tips for how to prevent diabetes? And then Stephanie can follow up with her top 3 tips on how to control or manage diabetes. Teresa, why don't we start with you?
Sure. And I'm just going to reiterate that to participate in an approved diabetes prevention program, the support really makes a big difference in the overall success. Trust that process of getting well and sticking with it, and then walk 10 to 20 minutes after each meal.
Okay. And then Stephanie, your 3 tips for controlling or managing diabetes?
Yes, thank you. I would say meals. We want you to eat the right amount of carbs, monitor the portion size, don't skip meals, and add snacks as needed. Then with your medications, take your medications as prescribed by your doctor, developing a routine. Talk to your doctor if you're having difficulty affording your medications or if you're experiencing side effects that may prevent you from taking those medications. And then movement, incorporating 30 minutes of exercise a day for a total of 150 minutes per week. That 30 minutes of exercise can lower your blood sugar for 24 hours.
Yeah, so it's a really great point as far as the exercise and kind of managing that blood sugar over the next 24 hours. So again, thank you both for joining us today, and thank you for your expertise and everything that you do for us. So to close out for today, if you or someone you know and love would like to visit one of our practices, the contact information can be found on your screens. Here's a list of diabetes-related community resources. Don't worry about writing down all of the links. The recording of this webinar will be posted to our YouTube channel shortly and shared with all attendees via email as well. Thank you for joining us today.